I'm a big fan of trying our best to identify the pathophysiological mechanisms that define the patient's underlying chief complaint symptoms. So I would say what I am trying to do as best possible is to best define the underlying mechanisms of the patient's chief complaint symptoms and match that with the interventions that fit most closely to those underlying mechanisms. And so, I believe that there are distinct and individually unique mechanisms behind many different manual therapies, from deep tissue massage to effleurage to active release technique and myofascial release technique and structural integration, blah, 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 et cetera. Exercise also has, very, very well defined mechanisms for how exercise influences physiology. Because last I checked, general exercise had very specific physiological mechanisms. So there's really no such thing as general exercise. If you go for a walk, there's very specific physiological mechanisms that occur when you walk. And there's also very specific biomechanics. And that's being repeated and oscillated over and over and over again, which also means you're getting rhythmic contractions and relaxations of the associated muscles around the spine and all the way down to your foot. So the point being is that if you dive deep enough, you can define very specific mechanisms that even govern the process of walking. Or are there specific mechanisms underneath stabilization system dysfunction and posture locomotor function that are potentially holding this patient in a pattern of chronic recurrent pain because of the way that they move?